Performing hemostasis within the GI tract is a technically demanding procedure, and use of EndoClot PHS and associated devices may result in patient injury, including but not limited to inflammatory reaction, bowel rupture, and air embolism. Use of a lifting agent during EMR, ESD, POEM, and difficult polypectomy and the associated devices may result in patient injury, bleeding, and/or perforation. ESD is technically demanding, and improper use may result in patient injury, bleeding, and/or perforation. Introducing EndoClot Polysaccharide Hemostatic System, PHS, intended for hemostasis flexibility. An EndoClot Submucosal Injection System, SIS, intended for higher and longer lifts. The versatile dual-knife J electrical surgical knife can be used to incise, mark, inject, and dissect. EndoClot SIS offers longer and higher lift compared to Eleview submucosal injectable composition. With a specifically designed spiral syringe, EndoClot SIS is intended to be delivered to the targeted area accurately. EndoClot SIS is designed to offer a high lift, which may create mucosal separation. It uses the same proprietary absorbable modified polymer (AMP) particles as the EndoClot PHS. EndoClot SIS does not leave artifacts that may cause abnormalities during pathological investigations. The dual-knife J electrosurgical knife is used to make the first incision outside one of the markings, creating a point of access into the tissue and starting the circumferential cut. Dual-knife J electrosurgical knife is guided through the submucosal space, maintaining a cutting plane parallel to the muscle layer. Should bleeding occur, a hemostat is used. EndoClot PHS is an advanced powder hemostat that is applied during the procedure using controlled, consistent air pressure. EndoClot PHS absorbs water from blood while causing a high concentration of platelets, red blood cells, and coagulation proteins, and thereby accelerating the clotting cascade. It is intended for use in combination with other conventional techniques for large and diffuse bleeds, such as those occurring during peptic ulcers, post-biopsy, polypectomy, tumor bleeding, post-EMR, and ESD. EndoClot PHS is also indicated to stop bleeds while treating peptic ulcers and adenocarcinomas in the GI tract. EndoClot PHS can be applied directly to the targeted site without reducing visualization, designed to allow further therapies to continue the procedure. If needed, EndoClot PHS can be irrigated after hemostasis has been achieved to verify all the bleeding has been resolved. Hemostatic powder composed of absorbable modified polymer (AMP) particles is safe to use, biocompatible, and does not contain any animal or human components. An effective GI procedure has been completed utilizing the EndoClot PHS and EndoClot SIS technologies.